So, Mr. Kataria, how critical WASH is in the management of coronavirus and how it has been left out in the entire scenario?
Well, thanks, Karan. As we all know, WASH, basically, which is water, sanitation, and hygiene, are important elements in managing COVID-19. So, just as an example, hand washing with soap is the first line of defense amongst few for the prevention of infection spread. Similarly, if we look at water availability, which plays a critical role, in these elements, particularly A, due to the summer water crisis, B, to manage the surge demand due to the added measures, and also C, because of the reverse migration of the migrant workers. So it has suddenly added more layers to it, and which also plays a critical role in terms of availability of it. Looking at the third part, which is adequate hygiene and sanitation facilities at public places, which are another critical element from managing the COVID-19. And lastly, but not the least, is behavioral change aspect towards maintaining adequate levels of hygiene and washing at critical times, and also looking at the immediate response to COVID by various organizations. These elements generally get missed out in that. So that's where I feel that WASH is very critical in managing this.
Yeah. Mr. Kataria, how do you think the NGOs working for water sanitization and hygiene are playing a pivotal role in containing the spread of transmission of coronavirus in India?
So current NGOs like WaterAid in the space of WASH are giving predominantly three-pronged response. Number one is short term, which has happened during the lockdown period. It is pertaining to the communication campaign to educate, spread awareness about COVID, and help taking measures which needs to be taken by communities to prevent the infection, which also includes hand washing with soap, social distancing, keeping adequate level of hygiene and sanitation at public and private spaces. Second pronged response is a midterm response, which strategically revolves around taking various measures, which includes, let's say, installing hand washing stations at public places, retrofitting of community toilets with adequate sanitation and hand washing facilities, working with healthcare facilities in the community settings to ensure adequate provisions of hand washing and hygiene to prevent the spread of infection amongst the medical staff and the patients, working with schools and Anganwadi centers to retrofit the toilets and also provide hand washing stations to ensure safe distancing on one hand and clean water on the other side, working with communities to educate them about messaging on behavioral change to manage this pandemic at a scale itself which is unprecedented, working with government departments to include provisions of WASH in their COVID management plans per se. And point number three, which is a long-term plan, looking at the critical shortage of water for working for the sustainable change of water-saving mechanisms like rainwater harvesting, water conservation through ponds and lakes cleaning, surface water management, and wastewater recycling. These are the things which actually will help in a longer way to sustain these measures, which will then provide the sustainable flow of water to manage this infection per se till a permanent solution is found on this. That's where I will stop.
We really appreciate your efforts in this time of crisis and wish you good luck for your endeavors. Thank you.
Thank you very much. Thanks to you and Bridge India as well for providing such a sort of a platform where people could come across and have conversations on such aspects. Good luck to you.
Thank you.